Okay, and we are recording. Guess I'm just a few seconds early, but why don't we just get started? Hi, everyone. Welcome to Region 7 Presents the Impact of Libraries and Informationists on Patient and Population Care. My name is Margo Malachowski, and my pronouns are she, her. I'm an education and outreach coordinator for the network of the National Library of Medicine in Region 7. I'm coming to you from UMass Chan Medical School, located in Worcester, Massachusetts. And my colleagues, Kate D'Angelo, who's also works in Region 7, and Erica Lake from Region 6, are here with me today. And they will help me drop links in the chat and help me keep an eye on the chat, on the comments and questions. Your microphones are muted, and we ask that you keep them muted just to cut down on background noise and on any unintentional noise. And you could type comments and questions into the chat during the conversation here, and then we'll have time afterwards for more questions, and perhaps at that point we can do some muting. There is closed captioning available in Zoom. You would just need to click on that CC at the bottom of your screen. We are recording this webinar on November 14, 2024, and all registrants will receive a link to the recording once it's processed and uploaded to our YouTube channel. So this webinar does grant one Medical Library Association continuing education credit. And to claim the credit, please click on the link that we will share in the chat after the presentation. So let me advance here. Before we get into today's topic, a word about who we are. The National Institutes of Health is the nation's leading medical research agency, and the National Library of Medicine is an institute at the NIH. NLM is the world's largest biomedical library, which produces information resources such as PubMed, clinicaltrials.gov, and Medline Plus. NNLM is the network of the National Library of Medicine. We are the outreach program of NLM. The network operates out of 7 regional medical libraries, or RMLs, and the RMLs provide training and funding opportunities to support equal access to biomedical information. So those are all of our acronyms. I mentioned in my introduction that Kate and I work in Region 7 and Erica is in Region 6. And Erica, if you could drop the link to where everyone could find their regional medical library. Now, earlier this year, meaning the beginning of the year, I was skimming the table of contents for the Journal of the Medical Library Association, and this title caught my eye, The Impact of Libraries and Informationists on Patient and Population Care, a Mixed Methods Study. And it had really caught my eye because a year prior, in January 2023, I hosted a webinar on the history of the Rochester study, which was also looking at the impact of libraries on patient care. And so this seemed like a great follow-up to that. And I contacted the authors, this team of librarians from Taubman Health Sciences Library at the University of Michigan, to ask if they'd be interested in sharing their experiences with mixed methods research. And they said yes. So now I will turn it over to Carol Shannon, Jackie Freeman, and Judy Smith. So I'm going to stop sharing. And
I will share my screen.
yes, and Erica has just shared the link to the article.
Okay. Yes, so my name is Carol Shannon, and all of us are informationists. I'm here with my colleagues, Jackie and Judy, and we're all informationists at the Taubman Health Sciences Library. And this is going to be a somewhat informal presentation. We're going to talk amongst each other, our little group, about what we did. And our title is something that it amused us, and it really sort of describes, we like to think in a positive way, the winding path that we took to get to the end of our study. We encourage you to ask questions along the way. You can also save them until the end. And there we go. I occasionally lose my cursor. We want to make sure that you know all of the team members. So in addition to the three of us, we also had Mark McEachern and Gurpreet Rana, who are also informationists at the Taubman Health Sciences Library, Craig Smith, who is an assessment specialist at the University of Michigan Library, and Jean Song, who used to be an associate director at Taubman, but is now director of the Mardigian Library at U of M Dearborn. So I want to talk about what we're going to do during this session, both what we'll do and what we won't do, so that we're all on the same page. So we're going to take you through our process to give you an idea of how many decisions there were along the way, when we had to change, how we made some of those decisions, and especially to show that you don't need a lot of experience to begin with, because we didn't have a lot of experience. We're going to talk about lessons learned, such as using all the help you can find, and you will need extra resources unless you have an amazingly well resourced library. It helps to have a willingness to learn, and you need to understand what the right sized team is for your particular project. Because we divided our team into different sub teams at different times, and that we think is how we got through the very long number of years that it took us to get to the end. What we're not going to do is to provide a breakdown in the various types of mixed methods research or an in-depth look at our interview and survey. And you can find more information on that in our article. So now I'm going to ask Judy some questions about the background information and about the project. So Judy, can you provide that background about the project? Where did we start?
Yeah, thank you. Um, just to give you a sense of the length of time, our original charge went all the way back to 2016, and a team of us at the Taubman Health Sciences Library were asked by our library administration to develop and pilot an assessment to evaluate how well our library, the Taubman Health Sciences Library, was doing. That was meeting the needs of our academic and clinical partners. We had a lot of leeway in terms of how to approach the assessment, which was fortunate and gave us a lot of room in terms of decision making as a team. There are so many assessments out there that rather than reinventing the wheel, we based our survey on a previously existing library survey. And at that time, we had a broad plan designed to be multi-pronged and scalable that would cover 5 broad categories. So we were focused on education and learning, research, service delivery, internal processes, and patient and population care. Our working group developed an assessment plan and an initial survey, and that was both were reviewed by Taubman administration. And we got some great feedback, and at the same time, they realized that other library surveys that were coming up would be covering similar territory. And so the group, our team received a different request, which was to discover the library's impact on patient and population care.
So how did the committee react to this, Judy?
That's a great question. I would say the committee was a bit stunned at first because we realized, we had spent a lot of time and then we realized we had to pivot to take on a different challenge. And more importantly, we had to think through how to measure impact when there's no direct contact with patients or populations. We knew we had to think a lot more about what methodology to use. It's always an issue, a problem in libraries, how to measure what impact we have because we never directly touch patients or populations, and there's so many other variables when our work is used. We knew that we wanted to go beyond just conducting a survey. It would have been easy just to take that path, but we really felt and we're determined to choose a methodology that would best match the needs of our project. I have to say, and you'll hear throughout, that having a strong team with a diverse set of skills is crucial, as well as having dedicated members who really want to work on the project, as opposed to being assigned, for lack of a better word, to work on it. For example, once we knew we were shifting gears into a different project, we gave the original team members an out in terms of working on it. We've been already working on it for a long time, and we didn't want team members to feel obliged to continue. So, a valuable lesson for us was being sure that the team composition and the dedication was still there. And we tried really not to be stuck, in who was on the team and what their roles should be. Yeah.
Judy, what were your next steps?
So at this point, we knew we had to think further about methodology, what would best match our needs, the project's needs. We knew that a simple survey itself would not gather the evidence we were looking for. And I think what we learned most at this phase was that we needed to go beyond our comfort zone in the way that we normally gather information. I think our instinct, as librarians, informationists, is to conduct literature reviews, but we really needed to go beyond that and speak to experts. So we did both in parallel. We wanted to see what research had been done before our project that attempted to capture the impact on patient and population care. So we conducted a literature review to get ideas. And through the literature review, we determined that the scope of our study had not been done before, but there were a dearth of studies that focused on libraries' impact on patient care, such as Marshall and colleagues' 2013 article, The Value of Library and Information Services in Patient Care. In addition to the literature review, we consulted with a colleague of ours at the library, Emily Capillari, who was not on the committee, but had taken a mixed methods workshop, and she introduced us to this methodology. And through our discussions with Emily, we decided it made sense to look further into mixed methods methodology. And then I subsequently took a mixed methods campus workshop, which allowed us to further tap into the experts on campus that knew, that really focused on that methodology.
We were very lucky to be able to access mixed methods methodologists easily and in quantity if we wanted to, because that relatively small unit had just expanded.
Mm-hmm.
And so it was a great time for this to have happened.
Yeah.
Okay. So what research design type did you decide on?
So we ultimately decided to go forward with the mixed methods methodology. And in mixed methods design, for those who are new to it, it combines both qualitative and quantitative data. Both are collected. And one part of the study informs the other and helps to tell the story of impact even better than one type of data could provide alone. There are different types of mixed methods designs, and the team determined that a sequential exploratory design matched our project's goals best. And this design begins with doing the qualitative before the quantitative. So we started with the qualitative, and it was a logical choice for us because we didn't know what questions we should ask in a survey. I think a challenge at this point, just to talk about lessons learned, was that we needed to not only learn about this methodology, but we needed to be sure as a team that everyone was fully on board and apprised about what the methodology entailed, because not everyone took the workshop and we didn't have at this point an overall assessment expert on the team.
So what other things did you have to think about early on?
Well, as the project started to gel, we felt more confident moving forward with the design. We also had to move forward, of course, with our IRB submission and be sure that everyone um, on the team took the required training to be part of the project. We also had to think more deeply about defining our terms, such as patient care, population care, library, and not make assumptions about their meaning. We had many, many discussions about defining our study population. For example, do we include medical students or do we not? And we ultimately decided no, because they don't have the final decision making with patient care. Um, we also had to think about team structure. So we divided ourselves into two subgroups so that we could get the work done with qualitative and quantitative. And because it was a long-term project, it gave us some needed time off. Um, Another lesson in team structure, we all don't need to do everything. We didn't have protected research time, so we had to be creative about structuring the team. Um, so we based the subgroup based on people's interests, and people were not restricted to just one team. So some people worked on both teams. So it helps to be flexible. And we realize, a big difference between our resourcing and resourcing for um, many hospital librarians is that we were able to gather a large team to work on a project over a period of time. We were fortunate, but even a small team or one hospital librarian could create a smaller scale project.
Okay. So
That,
now, yeah, that's fine. So I'd like to hand this over to Jackie, who will now talk with me about the early part of phase one.
Thank you, Carol. Um, Carol, would you describe what happens next for the project?
Oops. Just a moment. So once we understood some of what the mixed methods process demanded, we were ready to begin phase one of data collection, which was the qualitative interviews. So our first step was to compose and send a survey to our Taubman colleagues, requesting names of faculty members that they had worked with and who they thought might be interested in participating in our project. From that list, we wrote and sent emails asking for volunteers to participate in our pilot interviews. We got absolutely no response. We wondered if people were just not paying attention to emails from people they didn't know about a project they didn't care about. So we then asked our colleagues to actually write to the people they knew using our email template, and that was much more successful. And it netted us 2 faculty members for our pilot interviews and 11 others for the phase one study itself. We were able to get broad representation across stakeholder categories in schools too. So not just all clinicians, not just all medicine, nursing, pharmacy, but including public health and dentistry. And we had enough to reach saturation level for the interviews. That is, when you notice the same things coming out repeatedly.
Thanks for that. So, on the research team, you were working with a fairly small group of people. Did you feel the need to write any kind of guidance for, say, conducting the interviews, or was discussing the process enough?
We actually had a discussion about this, and we decided that, yes, we would create the questionnaire and a guidebook so that we would all use the questionnaire in the same way, even though in mixed methods, the interviewer is also considered a researcher, and sometimes you can choose to follow the question further along. But we wanted to make sure that we didn't skip any steps in the process and to try and reduce bias. The questionnaire we created was based on questions used in the 2013 Marshall et al. Article, but adapted for our specific situation. You can see the complete reference on the slide. We also tested out a potential new question that Jackie and I had found during our literature review. We thought that it was a good question and that it would elicit good information, but our interviewees didn't understand it that way, answering it just like another question in the interview. So we discarded it after the pilot phase. As an aside, we were able early on to locate a free source of voice recorders. This was before Zoom, so that wasn't even an option. But so we could use voice recorders at no charge during the interviews. And it was great to have one less thing to buy. We did apply for funding from the library so that we could afford to send the interview tapes to a transcription service and for some other costs, such as incentives for completing the quantitative survey. Although, as another aside, that happened to come shortly after the pandemic. And so we just missed the cutoff date for getting the money to be released to us rather than absorbed back into the university. So that was quite sad. What was great about having the transcription service was that that part was handled and we could put our efforts elsewhere. And the transcripts we received were time-stamped, searchable, and noted who was speaking when. Currently, there are AI options that might offer similar features for little or no cost, such as Otter AI and TurboScribe Free.
Thanks, Carol. I'll hand the questioning over to Judy now.
Judy, you're still muted. Sorry.
Thank you. Thank you for pointing that out. Okay. So I have some questions for you, Jackie. I know Carol was talking about the transcription services we used. So once those interviews were transcribed, could you describe what came next with the data?
Sure. So what came next for us was coding. And if we can have okay, we're on the right slide. That's great. So our coding was based in grounded theory, and that is we were allowing the meanings and the themes to emerge directly from the interviews that we conducted, rather than applying any sort of theoretical framework to them. So essentially, we became deeply familiar with our participants' responses and thought about the themes we were repeatedly hearing. Personally, I really liked the coding process. It relies on a lot of close reading skills that many of us with training as English majors had honed.
What new skills did you need to develop?
That's a great question. So we had to think about our reading a little bit differently. We had to think about different units of analysis. For instance, maybe were we going to focus on individual words or sentences or whole paragraphs? And then teach ourselves to develop a coding scheme that would allow a team of coders to apply the same codes in similar ways. So that can be really challenging when you're working with a partner. You're attempting to code and harmonize the way you code the same unit of text. So we developed examples from our data of how the codes could be applied, and then we worked through any discrepancies in our coding. I learned that coding really requires a lot of thinking time, and that thinking time happened both individually, separately when we were coding, and together when we would meet. So we had some good successes along the way with this process. We developed what we called coding sprints. And these were chunks of time in a single day where we could code separately, chart our work, discover the differences, and meet to work those differences out. The sprints didn't make the thinking work any faster, but it allowed you to meet right away while the close reading you had just did was performed and it was still fresh in your mind, rather than waiting for another time to meet. And we found this to be a really practical solution. I want to mention, though, another consideration. Though we had two coders, many qualitative researchers work solo. There are acknowledged limitations with solo coding, but there are advantages too, such as not needing to find time to both code and harmonize your codes with another researcher. Our codes, as well as those used in the Marshall article, are available for adaptation. So reusing what you can from other published projects, along with the ability to move at your own pace, can make coding solo feasible for a project like this. Still, coding takes time and reflection. So even with being able to move at your own pace, you'll want to plan for it to take as long as it takes.
Yes, coding can take a very long time, as we learned. Um, what's another takeaway from your experience with coding?
Well, my takeaway is, coding is great brain work. It requires that time to think and process, and that you can make good progress on your project if you can dedicate little chunks of time to it.
Mhm, mhm. So the qualitative phase was now complete. How did you plan the next steps?
All right. So, having discovered the themes we wanted to probe further from the qualitative data, we reached the quantitative phase. And at this point, I want to just mention the timeline for a minute, which is what you're seeing on the slide here. This was the timeline that we thought, hoped, and planned to be on. If you advance it to the next slide, please, Carol, you will notice that originally we thought the work could be completed by 2018, but in actuality, this work took an additional 4 years to complete. So the reality of the time that we had already invested, plus where we still needed to go, played into our next moves. We had some ability to carry on into the quantitative phase with our existing team, but we knew we needed additional expertise in turning our ideas for a survey into a concrete tool that we could deploy.
So when you're at this point, very deep into a project, still a long way from completion, what's a good next move?
Well, I would say to look to what expertise that you can tap into. So our library had recently hired an assessment specialist who agreed to consult with our team. Craig added so much to our efforts that we asked him to become a full team member, and he agreed to do that. And this was really essential for us. The sum of all that we needed to learn from scratch about survey creation, about tools, about the deployment of the survey would have slowed us down tremendously, and we still would have lacked the deep experience and insight that Craig brought to our team. So I would say, have a look at your local experts or tap your wider network for expertise and offer to make them full team members and co-authors. Part of our, shall we say, ethos as a team was learning. Craig guided team members in learning data cleaning tasks and some of the basics of running queries in SPSS. And I want to stress here that we did not learn everything, that one might learn in this process, such as how to test our analyses for significance. And that was okay. And that's where we relied on Craig's expertise. But we gained exposure to the various procedures and tasks associated with working with our quantitative data.
So Jackie, what's the lesson you would share?
I would say that sometimes a just enough learning approach is sometimes necessary to push through to the finish. You may not have time to take that statistics course you always meant to take, but it might not be necessary if you include people with the right expertise on your team.
Thank you, Jackie. I'm going to turn it back over to Carol.
Okay, so I'm going to just talk about a few things to wrap up before we get to your questions. We had got a lot of publications out of this. Some of them were internal to like small assessment. We have had a tiny studies group, and now we have an assessment SIG. Now that Craig is at the library, and all of us would just say, I think we might have died and just stopped where we were if we hadn't been able to make Craig a part of our team, not just as somebody giving us some of his time, but to really work with us. And we also did presentations for MLA and I think for the Midwest chapter and my ALA, which is part of ALA. And then, of course, our article written and published in GMLA. We can't emphasize enough that you need to use all the help you can find. Most of us, but not all. I mean, if you're in an academic library, you probably have more people that you can tap for their expertise than you might have in your actual library, because you could be like one of three medical or health sciences librarians, and that's not a big. It's more than a solo hospital librarian, but in terms of doing research, it's not a big step up. So remember to look and see what you can do. Our biostats department in the School of Public Health has a student group that provides free consultations. And then we have another group that is fully professional that you can go to, especially for heavy duty statistical help. Just look as far as you might want to see if you can get help of whatever kind you need. Look for extra resources. Incentives don't have to cost an awful lot of money. So you might want to say, okay, we can't use money for anything, but we will offer incentives, just a chance at an incentives for the quantitative part. Be willing to learn. We keep saying this, but it's true. We did this all along the way. A just enough learning approach is sometimes necessary to push through to the finish. We often felt that we were pushing through. This did get very hard at times, which is why Craig's appearance, miraculous appearance, was so wonderful. But yeah, if you don't think that you have to do it all by yourself, or you and one other person has to do everything, you may be able to do a bigger project than you thought you could. It's important to have the right size of a team that's dedicated, and it's really great if you can get protected time. We did not have that. You don't need to have a large project, because even a small focused project can be really good if you do it properly. Recognize and adjust for burnout. We had that along the way, and we did that by dividing into different groups. And one thing I forgot is one of the ways we divided up was the way we got through our article for JMLA was to take another small group, and that was Jackie, Judy, and I. And Jackie and I did that. We had meetings every other week, and most of the time we admitted to each other that we'd done the work right before we met, but that was fine because it got us through. And we never tried to give ourselves like, you have to write your whole section in 2 weeks. It was always a chunk, because otherwise we couldn't have coped. We had a lot of other work. So yeah. And then when we had questions or it seemed appropriate, then we sent it to Judy for feedback. And then when we got ready to submit, we sent it out to the whole group. And then after a couple of rounds of reviews, then we sent it out to a whole group before sending the final manuscript into JMLA. And that made it possible for everybody to keep going. And reuse what you can. You do not have to reinvent the wheel. There is a lot of good work. I don't know if any of us can ever really figure out how we can truly judge our impact, because as Judy has said before, we provide information to other people who then go and do various things to it, depending, choose what they want to use, and then it touches the patient or the population. So we are a big giant step away from true having a true impact on those. But there is still information to discover, and there are good places for you to start. And we're happy to take your questions, if any.
Thanks so much to all of you. And we have two options here. You could put something in the chat, or you could. I'm actually not seeing the raise hand. Erica, do you see where the raise hand thing is? Mine's not showing it.
It's gone to more.
More. Oh,
Yeah,
okay.
yeah.
So you
It's
could,
really annoying.
yeah. Um, but I just want to say that your teamwork is so obvious, even just in how you've chosen to present today. So that speaks volumes to your work together. So does anyone have a question about the process?
And I'm happy to stop sharing the screen so that we can just see each other.
Yeah, that might.
That might be good.
Yeah.
There we go. Please ask us questions.
Yes. I guess one of the first things that I noticed is how long the process took you.
Yeah.
And you had the
That,
pandemic in
that,
there too.
that comes from not having protected research time. So for any project that we do, there is no protected time. And that's a real problem. And I would strongly recommend that, or we would strongly recommend that you get a certain number of hours, sort of average per week, that you can spend on that project. The time you spend will vary, but just make sure that it's on your calendar and that time will be sacred. Um, and you cannot be interrupted during that.
Okay, we do have a question. What
I
qualitative
mean, it's something,
analysis?
oh,
Yeah,
wonderful.
qualitative analysis tool. What did you use?
Oh,
SPSS.
well, that is definitely one of the tools that we used.
Right,
It
yes.
does, it allows you to do a lot of queries with your survey data, but in particular for the analysis of the interviews, Judy and I did a combination of old-fashioned, on paper coding of particular excerpts and using Deduce, which was a tool that was new to us. But we had access to it, and some portions of it were fairly intuitive. And so being able to use Deduce allowed us to, do things like frequencies, some small crosstabs, and being able to search our upload transcripts, search them, and find units of text that we wanted to sort of search across all of the interviews and see what our participants were saying about different aspects of our work.
Great. Okay, are you planning to do something in terms of next steps or ready to move on to something totally different?
I asked this question. I just asked it, I didn't answer it.
I don't think that we are planning any mixed methods study right now. I think it gave us some other thoughts about our work, but people are working on different research, I believe, but I don't think there's any mixed methods in the works.
I think what we did do as far as next steps from this particular project is to provide an executive summary level report to our leadership to share with them what we had learned after this incredibly long process. And there were some indicators of next steps that could be taken, such as different core teams might reach out to their respective groups in different ways or investigate specific items that a discipline might feel that the library doesn't supply. And in the cases where they do, and we do supply it and they aren't aware of it, to increase our efforts to make people aware of different tools. So we have had some little bits of internal work that happened as a result of our project. But yeah, I would agree with Judy. I don't know that we have another mixed methods idea on the horizon, but I wouldn't be adverse to it. It was such engaging work. And as Carol said, we didn't have protected research time, but one thing that we did have was intense interest in this work. So, I would often find myself blocking time on my calendar so that I could work on it because I really was intrigued by it.
Yeah, Jackie, I also love that you talked about being able to tap into your English major self too. All
Yeah, I
right.
bet you several of our audience members can relate to that background.
Okay, so I worked for a number of institutions that have struggled to get patrons to fill out surveys. When we've reached out to colleagues as to why they haven't completed a survey, we usually hear the following comments: I hate surveys, or I have no time. And I feel you when you said you sent out that first email and nobody replied to you. So you want to talk a little more about that?
Well, one thing that's interesting about surveys with this particular population is that we really struggled with what would incentivize them.
Mm,
If we were going to have a drawing for a gift card, et cetera, it was difficult to think of something that, might encourage somebody without being coercive, because of course that's the other side is that they can't be so great that they might bias the answers that people would give. So one other like little piece of that is that our survey went out in July or August of 2020, like
August.
right in the midst of the pandemic. So I mean, we worried that we weren't going to get any responses at all, right?
mhm,
Which was absolutely a possibility. Our the people that we were surveying were, front of line,
mm.
dealing with that crisis. So it was really rewarding to see, that we did get, a good response from our participants.
Great. So, Ellen, you can go ahead and unmute and ask your question.
I was commenting about surveys. People get so many surveys. I walk into my bank to take out money. I get a survey. So I'm just so tired. I say, what is it in it for me? Everybody wants a survey. Please stay on after you speak with the person for a brief survey. It's gotten to the point where it's ridiculous. And because I'm very jaded, and I say, the surveys want my information because it has some value to it. Therefore, if it's of value to you, you pay me for it.
Mm.
And they don't, so I'm a bad case, but you have to think about that. I mean,
I
It's
understood.
true.
I understand completely.
Yeah.
Once I even got two requests for me to rate my PCP after a visit, one from Michigan Medicine and one from the actual site. And I just said, no. I said no to both. The one from the actual site is much shorter. I have no idea why Michigan Medicine thinks they can get anyone to answer a really big survey. And we thought about that carefully because we knew there would be people saying, no, we don't want to answer any survey for any reason. So we were careful about the number of questions we asked. The only thing that changed was that when we initially were going to send this out was at the actual beginning of the pandemic. We sent it out 6 months after it started. So we stopped and we added a short section on how people were using the library during the pandemic.
Yeah.
And that was interesting because some people said that they wanted to use the physical building and items more. That was not what everybody said, but it was interesting to see that happen.
Yeah, the other thing is I will answer surveys at work if I use the vendor on a regular uh, basis. I can't tell you how many times I start a survey and it gets too detailed or too long, and I just
Yeah.
bail in the middle.
Yeah.
I
Hmm.
close it,
Yeah.
Yep.
and
Yep.
it adds to my being jaded about surveys.
Yeah.
Yeah.
No, yeah. And there's I prefer to fill out a survey after I've had bad service. So, I think that's also taking that into consideration that although nobody gets bad service from the library, but,
Yeah.
but maybe that would
Some people have
factor.
claimed on, I can't remember if it was on our survey or the library's survey, but yeah. And sometimes it's just how it's perceived. We might not be able to help them in the way they want to, and there's nothing we can do about that. Um, and that is our fault.
Yeah.
I do try to respond to some surveys, so I'm not just responding when something has gone wrong, because I want people who did a good job to know that that was appreciated and noticed.
Hmm.
hmm hmm I think, yeah, putting a survey out there makes you appreciate um,
Yes.
the need or that this is one of the few ways we have of collecting good data. So
Hmm.
it's really hard. I really wish that there was another way um, of um, of knowing, more about our patrons. We need a new research method. And I
Hmm.
think the other thing about surveys is once you've deployed one and you've looked at the data, of course, there are things that you would do differently,
Right.
questions that you realize, even though we piloted our survey and, did a lot of cognitive review of the questions, but there are things that, aren't as clear as you thought they were,
Hmm.
or people interpreted the question in a different way than you expected. So there's a lot of learning with the survey process.
Yeah. Another
Although
thing
there's
oh, go ahead.
I don't think there's really any way to have a survey totally, completely understood by everyone when you're talking about however many thousands of people we sent it out to. That's just such a large population. You do the best you can, and then you stop.
Yeah, the other thing I jotted down while you were talking, and this is also kind of an English major thing, is defining terms.
Mhm.
Um, and,
Yeah.
and I'm hoping that some of that process was enjoyable, actually, kind of, and illuminated who you're serving.
Well, we did in part because while we have a space, we don't actually have books in the building. You can get books, we can request physical books, and it often takes just 24 hours to get them. But we wanted to make sure that people knew that the library didn't mean just the space on the fourth floor of the Taubman Health Sciences Library building, that it included access to all of the resources that
Mm,
they use on a daily basis,
hmm. Hmm.
including including people, including
Yeah.
people.
including people. Yeah. Yep.
Yeah. Oh, were you going to say something, Carol?
No.
Yeah. Yeah, I would say, Margot, that's, your question about defining the terms. I think it was very enjoyable to talk about it. I would say it surprised us how long it took to
Mm,
get to some of those definitions because something you think is clear, someone else in the group would bring up a good point about why it wasn't clear. And so it took a lot more time than we anticipated.
mm, mm. Yeah, and I'm wondering, I don't know if anyone in the the room here is a hospital. I mean, I'm sure there's some solo hospital librarians that would benefit from getting together with other solos to do that sort of brainstorming work or those conversations could happen maybe within the caucus of the Medical Library Association or something like that. And I just see if anybody, folks, go ahead. I'm just looking at my own notes. Then I did in terms of hospital librarians. I know that I used to work I worked for 8 years in a hospital. And at one point, I reached out to I actually forget what my question was, but I reached out to the internal experts to help me with something, and they turned me down. And so it might be different in an academic setting, but I think they felt like they didn't have the bandwidth to help the library and suggested that I ask my director for guidance. But my director hadn't done whatever it was, like she wasn't in the position of acting as an expert on what I was. And as I said, I can't, it might have been some survey kind of thing that I was hoping to do. So I don't know if, somebody here has said I'm a solo and recommend connecting with the MLA research section. Okay. All right. Yeah, I was actually just at a chapter meeting for the North Atlantic chapter of MLA, and they were talking about a research um, effort. I wonder if anyone in the chat knows more about that. And I'm hearing they may have expected a hospital librarian to have funding, and that's how my research people would respond.
Yeah. Hospital people or Michigan medicine people are or used to be very surprised when they heard that we did not charge for our services in
Mm.
general. There are few times I could, for working on guidelines for an association, that there is a charge because that is indeed what they expect.
Okay.
There is a charge for everything because, if you rent a room, even if you're part of Michigan Medicine, unless it's within your own department or division, there is a charge.
Okay.
Yeah.
And here Ellen has added, if your institution has a research committee, you could try reaching out to them, or you could have a library student intern to help you with the research. So these are often opportunities for you to hear some really nice things about the library when you were contacting people who are happy to help. Was that gratifying? Yeah.
Yeah, definitely gratifying. Many of my colleagues who've been doing this work for a long time and have some really deep connections with our patrons. Carol and Judy primarily did the interviews, but having read those interviews, I, recall the times when specific names of informationists would come up, and even though I wasn't physically seeing their faces, there was almost this like glow in their language
Mm,
about how that person had really had an impact on them and taught them things that were well far and above what their expectations were. So yeah, that was very, very gratifying.
hmm
And being able to share, those comments back with our colleagues was really great.
hmm I often feel that appreciation of libraries really starts with childhood experiences of, good experiences with libraries. I think that people carry that through their lives.
Absolutely. And some of our participants were carrying experiences from other institutions too,
Mm,
where, they weren't having a bad experience someplace else, but they were just gratified to see that the things they knew libraries could do,
hmm
that we offered them and excelled at them.
mm. Yes, and someone has commented having met graduate students who never had been to a library. Yeah, there's that too. But that I always think it behooves us to support the public libraries and school libraries because down the line that's a different kind of pipeline, but it's a pipeline for our services, I think. So, all right. Well, my colleague Kate has the link for the CE. If Kate, if you want to drop that in the chat, thank you. And we do have a couple more minutes if somebody has another question. Otherwise, thank you so much for joining us. And this was a really lovely presentation. Again, I really enjoyed the way you handled it.
Thank
Thanks.
you for asking.
Yeah.
Sure.
It was fun to speak with you.
All right, we're getting some thanks in the chat. All right, I will stop the recording now.